The past 2 years have been very challenging for this family. This mother tells me she fears what these cuts can mean for her daughter, who is bravely fighting cancer.
In a home where everything seems normal, there's a family facing an unimaginable battle.
What is that like when you're told your daughter has cancer?
It's really blindsiding. I can still remember the moment of that phone call. And everything kind of just stops. You go numb.
Christy's 12-year-old daughter, Sadie, has been battling acute lymphoblastic leukemia for nearly 2 years. She's considered high risk because of her age and the number of cancer cells found in her bone marrow.
Sadie has spent about a year in the hospital total. We have been home now for probably about a month, a little over a month, but we frequent the hospital so much. We actually have her on hospice and palliative care, so she has nurses that come to the home and treat her.
For Sadie, Medicaid covers a majority of her treatment, but Christy tells me there is much more financial burden that falls on her family.
So the expense is, I couldn't even tell you, but I could tell you it's so expensive I wouldn't be able to afford it. When I travel to Utah to see specialists and things, those are things that we cover out of our own pocket, that we have to drive because we don't have the luxury of having those specialty doctors here in Vegas.
I know that Medicaid and Medicare.
Andrea Rapanos, a volunteer with the American Cancer Society, recently traveled to Washington, D.C. alongside 350 other advocates for the 15th Annual Alliance for Childhood Cancer Action Days. She says her mission is to secure funding for critical childhood cancer programs like the one Sadie is in.
I, in particular, was focused on, and just, as a social worker working in this field, is the preservation of Medicaid.
I found out that as of August of 2023, the Nevada Department of Health and Human Services reported that more than 900,000 residents were enrolled in Medicaid. But proposed federal budget cuts are raising concerns.
People don't realize one round of chemotherapy treatment can be upwards of $12,000 or more. And when you have a child who has to go to treatment 5 days a week, you do the math.
Cutting Medicaid, you're losing so many people and you're just leaving them stranded.
Those are just some of the syringes that you use.
Already having your daughter being diagnosed with cancer is so challenging, but when you're also hearing about this financial uncertainty, how does that make you feel?
I'm terrified, but I try to just kind of hold everything together because I still have a whole family that relies on me for everything. And I don't want any of my children, my family, to see the worry. I don't think, honestly, until someone goes through what we're going through, they understand what it's truly like to walk this path.
I have to say, Sadie is such an incredible teenager, and she is definitely a fighter. Now, Andrea also tells me she'll keep working with lawmakers to fight for medical coverage, especially for families like Sadie's. I'll be following this very closely and keep you in the loop. Reporting from the studio, I'm Abel Garcia.